Hello, I am Annie Estes, soon to be BSN to DMP graduate in the family nurse practitioner track. I am the health aide for Representative French Hill, and this is PDMP Saves Lives. So, what is a PDMP? A PDMP is a prescription drug monitoring program, which is an electronic database that tracks controlled substance prescriptions. PDMPs can help identify patients who may be misusing prescription opioids or other prescription drugs and who may be at risk for overdose. Clinical practice guidelines encourage the use of PDMP prior to prescribing to assess the patient's history of controlled substance use. It is possible to improve the way opioids are prescribed, reducing the number of people who misuse, abuse, or overdose from them while making sure patients have access to safe and effective pain management. Diversion of prescription drugs for non-medical purpose is a serious public health concern. Over 50 million individuals ages 12 and older have misused prescription drugs in their lifetime. After marijuana, prescription drug abuse is the second most prevalent drug abuse. More than 1 in 4 drug users began abuse with prescription medications. Commonly abused prescription drugs include opioids, stimulants, and anxiety medications. Economic cost of prescription drug abuse has been estimated about $80 billion annually. This is from loss of productivity, criminal justice expenditures, drug abuse treatment, and healthcare costs. From 1999 to 2019, nearly 500,000 people died from an overdose involving any opioid, including prescription or illicit opioids. This light blue line in this chart shows the trend in deaths involving prescription opioids from 1999 to 2019. In 2013, 249 million prescriptions were written for opioids. That's enough for every single adult American to have one bottle of pills. Additionally, 136 people die every day from an opioid overdose, showing that this is a serious problem. One way to help combat this epidemic is to educate and support providers, healthcare systems, and payers with data, tools, and guidance for evidence-based decision-making to improve opioid prescribing and patient safety, such as PDMPs. Literature suggests that mandating PDMPs can greatly improve the abuse of prescription drugs. However, while 49 states do have PDMP access, only 42 mandate PDMP use before prescribing drugs. And Missouri does not have PDMP access at all. We urge policymakers to mandate that all prescribers must check the PDMP before prescribing medications every time. This includes opioids, stimulants, anxiety medications, etc. So how do we know that PDMPs work? Here are some examples. In 2017, Arkansas passed Act 820, which mandated prescriber usage of the PDMP. From 2016 to 2018, Arkansas saw a 21% decrease in the number of opioid pills prescribed. Ohio mandated PDMP monitoring in 2011 and saw an 85% decrease in morphine milligram equivalents per capita from 2010 to 2015. And Kentucky mandated PDMP in 2012 and saw a 62% decrease from the same timeline. In 2012, Tennessee required prescribers to check states from PDMP before prescribing opioids. They saw a 36% decrease in patients seeing multiple providers for the same drugs in the year 2013. Many providers resist the PDMP because they are pressed for time, and often these databases are not well integrated into the EHR. However, states like Arkansas are making it easier for providers to check the PDMP by integrating access into their EHR, which provides a streamlined clinical workflow for providers. Instead of separately logging into the PDMP, the EHR automatically initiates a patient search and returns a view of the patient's controlled prescription history report directly to the provider's EHR. Additionally, there are several phone apps that make this process simple as well. The Arkansas State Department of Health partnered with Apres Health to provide this integration option to Arkansas prescribers and pharmacists utilizing a service called PMP Gateway. This is a multi-state query system that provides access to a majority of state PMPs. With funding awarded from the CDC, the Arkansas Department of Health covers licensing fees associated with the integration service for approved healthcare entities over the duration of the grant. We urge policymakers from Oregon, Idaho, Montana, Nebraska, Missouri, Minnesota, and Mississippi to mandate that their providers use PDMP before prescribing medications, and to work with their state health departments and the CDC to find funding for the PDMP and also ways to make it easier for their providers. With more providers utilizing the PDMP, together we can save lives and decrease the burden of cost from prescription drug abuse in America. Thank you.